For this study called the PREPARE study, you have been selected to be in the group that will be given a second type of inhaler to use at the same time you use your rescue or quick relief inhaler. That means that we will teach you how to use your two inhalers whenever you have asthma symptoms like coughing, shortness of breath, or wheezing. For each puff of rescue or quick reliever like albuterol, you will then take a puff of the medicine we give you called QVAR. Let us demonstrate. So you take one puff of rescue or quick reliever to one puff of QVAR, or 2 puffs to 2 puffs, or 3 puffs to 3 puffs, waiting 5 seconds between each puff. What is QVAR? It is an inhaled corticosteroid sometimes used as a controller medicine. But for this study, you will be using the QVAR we give you at the same time as the rescue or quick relief medicine like albuterol your doctor or nurse has told you to use. So during the study, each time you use your rescue or quick relief inhaler such as albuterol, ipratropium, or Combivent, when you have an increase in wheezing, shortness of breath, chest tightness, or coughing, you also use your QVAR, puff for puff. The QVAR is not an experimental medicine. It has been used for asthma for many years. We are just using it in a little different way. So again, if you feel shortness of breath and feel you need to take your quick relief or rescue inhaler like albuterol, in addition, you will also use a QVAR inhaler, puff for puff. Why add the second inhaler? Your usual rescue or quick relief medicine like albuterol works by relaxing the tightening of the muscles around the airways. While this may give you relief right away, it only lasts for a short time and does not work for the inflammation of asthma. This means that the symptoms may come back in a few hours. The QVAR inhaler helps with inflammation. We believe that the combination of the medicine for airway tightening called bronchoconstriction together with the medicine for inflammation would give you quick relief and help keep the symptoms away longer. Studies have shown that adding the QVAR type inhaler along with your usual rescue or quick relief inhaler can decrease your visits to the emergency room, decrease the need to be in the hospital, or decrease the need to take steroid pills for asthma attacks or episodes. Will it be hard to remember 2 inhalers? To help you remember to use both the new QVAR and use the rescue inhaler, we have given you a special Velcro strap that holds them together like this. You will also get to choose a pouch that can hold both of the inhalers with the Velcro strap. The pouch is important for keeping the two together with you all the time. The pouch was selected to fit in your backpack or purse. We have worked with a group of asthma patients like you to find useful pouches to take everywhere you go. What if I use a nebulizer for my rescue medicine? If you use a nebulizer for rescue medicine, please use 5 puffs of the QVAR after you finish the nebulizer treatment. Why take 5 puffs? Because a nebulizer gives you more medicine than you just taking 1 or 2 puffs of your rescue or quick relief inhaler like albuterol. So you need to take more to have equal amounts of medicines. Again, take the 5 puffs of QVAR after the nebulizer treatment. How do I get the QVAR? Today, you will be given your first QVAR inhaler, and we will review how to use it. During the study, you will be able to get free refills of the QVAR when you need new QVAR inhaler. You can call the phone number on the Velcro strap right here. You should call for a refill when the counter of the QVAR reaches 20. Here is where the dose counter is. We know that you still have many puffs left, but we want to make sure you receive your new QVAR refill in time to begin using once your old QVAR reaches 0. You can wait to begin using the new QVAR inhaler until the dose counter reaches 0. What else is in the pouch? Inside your pouch are some other important cards. The yellow card has information about the study that you can give to any doctor or nurse you see for asthma in the office or the emergency room. This will let them know that you are part of the PREPARE study And that is why you are using 2 inhalers whenever you need rescue or quick relief medicine. We are asking them not to change the QVAR medicine without calling the number on the yellow card and talking to the study team. You can also tell them that you were supposed to use a QVAR with your usual rescue or quick relief medicine like albuterol. The yellow card has a web address and QR code to scan to make it easier for the doctor or nurse to get more information about the study. The number to call for QVAR refills is on the back of this yellow card, as well as on the Velcro strap. We will give you extra copies of the card to keep in your wallet as well as your pouch during the study. Also inside the pouch are some sheets of stickers that we want you to put on each new QVAR and each new rescue or quick relief inhaler when you take it out of the box. These remind you to take a puff of QVAR each time you take a puff of your rescue medicine. Puff for puff, 1 and 1, or 2 and 2, or 3 and 3 puffs. What about the medicines I take every day? We know that you are using 1 or more other daily maintenance or controller medicine inhalers besides your rescue or quick relief or albuterol inhaler. These medicines usually include a daily inhaled corticosteroid, either alone like Flovent or Asmanex, or in combination with another medicine, such as Advair, Symbicort, or Dulera. Don't stop using your controller or maintenance inhaler even though you are feeling okay and don't have any asthma symptoms without speaking to a doctor or nurse. Asthma is still there even when you are not having symptoms. What if you are already taking QVAR as your daily controller or maintenance medicine? You should continue using it every day as your doctor or nurse has prescribed. Whether you are on corticosteroid alone or a combination drug, do not use a QVAR we have given to you for the study instead of your controller or maintenance medicine. The QVAR we gave to you is to be used puff for puff each time you use your albuterol, ProAir, or Ventolin rescue medicine. The study QVAR is in addition to, not instead of, any of your other asthma medicines. Keep getting your usual medicines from your clinic and usual pharmacy. Exactly how do I use the pouch and the medicines? Both your rescue or quick relief inhaler and the QVAR go into your pouch, so you can have them with you at all time. You should use the 2 inhalers whenever you have an increase in wheezing, shortness of breath, trouble breathing, or whenever else you would feel you need to use your rescue quick relief inhaler or albuterol. You will take the inhalers out of the pouch and use the 2 inhalers like this. First, take as many puffs of your usual rescue or quick relief inhaler as you feel you need. Then, take many puffs of QVAR as we are doing here. If you are not getting relief after using your quick relief or rescue medicine several times, or if you are unable to speak in full sentences, unable to lie down flat, or having lots of trouble breathing, seek medical help immediately or call 911. Will I be taking too much medicine? Some people may worry about taking more puffs of an inhaled corticosteroid or ICS. But what we are trying to do is to prevent you from having to take steroid pills or steroid shots for a full-blown asthma attack. The small amount of extra ICS you will have to take is like taking an extra thimbleful of ICS instead of a barrel full of steroids in the pills or shots that are needed to treat a full-blown asthma attack. So let's review. During the study, you will be taking 2 inhalers, the QVAR, and your usual rescue or quick relief medicine like albuterol. Anytime you have more coughing, shortness of breath, or wheezing as you feel you need it for your asthma, the difference is that each time you use your albuterol, quick relief, or rescue inhaler, you will also take your QVAR, puff for puff. These medicines work both on relaxing the tight muscles in the airways and reducing inflammation. We believe that the 2 together will help prevent serious asthma attacks. And you are helping us prove this, so we can improve asthma care for patients like you. You will need to continue taking your other asthma inhaler medicines as instructed by your doctor or nurse. We will give you free QVAR to use with your albuterol or rescue or quick relief medicines during the study. Remember to call for a refill using the number on the Velcro when the dose counter gets to 20. You will call your usual clinic to get refills on all your other asthma medicines and to make appointments for your usual asthma care. How does the study keep track of how I am doing? Each month for your next 15 months, you will receive a short set of questions to answer. The questions ask you about any asthma problems you have had since answering this last survey. The monthly questions are the same each month. We have tried to make them as short as possible, and they are very important since they are the only way we will know how you are doing in the study. The questions can be answered on your smartphone or computer, or they can be mailed to you each month. Please let us know which way is best for you. Because the questions are very important to the study, each month we will send you reminders to answer the questions and pay you $20 for each of the surveys you complete. If you have had problems with your asthma, like having to go to the emergency room or hospital, or having a worsening of your asthma in the past month, we may call you to ask some extra questions. Those phone calls will come from the Central Line Prepare Study or 1-802-333-3393. So if you see this number, please answer the phone. You will receive payments for your time today, and each time you answer the monthly questions, for each set of monthly questions you answer, you will be paid $20. This money will be put to the money card that you will be given today. We will also put $50 on it for your time today. The money will be on the card within about 3 days after this visit, and after you answer each monthly set of questions, the money on the card can be spent in any store that takes debit cards. You will not need a password or a PIN. If you lose the card, it can be used by anyone, so please keep it in a safe place. While we can give you a new card, if you lose this one, we will not be able to replace the money that was on it. If you need a new money card, call us at the number on your yellow card, 1-844-707-3239. If you do not spend the money within 90 days of receiving it, the card company will charge you $3 each month until you use the money.
Hi, it's Dr. Elliot Israel again. We are very excited that you will work with us. You are part of the group that will be using QVAR each time you need to use your rescue medicine. Remember that the QVAR you should use each time you feel you need to use your albuterol reliever is in addition to, and it is not instead, of any of the other medicines you currently take. You will continue to use all of your daily medicines. You and your doctor may change your daily medicines, but you will continue using QVAR with your rescue medicine regardless of any changes to your daily medicine. Our patient advisors have told us we should think about this as QVAR also, not instead, of any asthma medications you may be prescribed. So remember, every time you use your quick relief albuterol, use your QVAR also. But that QVAR is not instead of any of your other medications. QVAR also, but not instead.
Thank you for being part of this important study. The staff will now ask you to review what you have learned.